Hello everyone and welcome back to What Everyone Should Know About Health. This is Series 1, Episode 1, and I'm joined again today by Dr. Elizabeth Hughes, one of our co-founders. We promised that we'll always get straight to the point. So good morning, Elizabeth, and I have three questions initially, and they're all interrelated for you. So let's get to the point. What is a virus? What is a coronavirus? What is COVID-19? What is the difference between them?
Okay, great questions. Thank you for having me here today, by the way. So a virus is a particle of genetic material, usually RNA, sometimes DNA, encased in a protein capsule. These viruses circulate around us all the time, and there are hundreds, if not thousands, of different specific viruses. Most viruses don't cause any problems. Most people are immune or have some natural immunity to viruses as well. But so that's what a virus is as a big thing. The way viruses work inside the cell is they don't cause illness in and of themselves. When a virus, because it's not alive, it's not growing, it requires being inside your cells. So when a virus attaches to a cell of a person who doesn't make an immune response to it before it gets there, when it attaches to a cell, it injects its RNA, its genetic material, and then kind of hijacks the cell's mechanisms of producing proteins. And the only thing that the virus produces is proteins that are part of its coat, like part of its capsule. And so cells, instead of making structures that help the cell, well, they start making virus particles. And that's when the cells become abnormal, and then the cells spit out more virus particles, and you go on from there. Now, a coronavirus is just one of the many, many viruses that are circulating in our environment all the time. And pretty much everyone has had a coronavirus infection. Coronavirus is just one of the types of viruses that cause the common cold, along with rhinoviruses, adenoviruses. And coronaviruses are responsible for about 1/3 of those common colds. Now, the specific coronavirus that is now called SARS-CoV-2 is a coronavirus that is the coronavirus that is circulating right now. It's a little different because every virus varies on what proteins it produces, varies slightly. So the coronavirus that is circulating now is just a variant, a family member of the larger coronavirus category. Now, COVID-19 is not the virus, and that's really important to know. COVID-19 is the illness that a few people who are infected or have had exposure to the coronavirus have. But it's not a one-to-one relationship. And this is important to know. If you are exposed to the current coronavirus, you are not 100% guaranteed to become infected by it. It may have no effect on you. If you are infected by it, you are not guaranteed to develop the syndrome called COVID-19. In fact, most people don't. Most people remain asymptomatic, and the people who are ill, most of them have a mild illness, a mild, sort of bad cold. And I don't want to say that it's not an unpleasant situation, but it's not something that requires hospitalization or medications or anything like that. And there are very few people who are exposed to this new novel coronavirus who develop the syndrome of COVID-19. But it's not a one-to-one. It's not, I'm exposed, I will get it. The number of people who are exposed to the virus who actually end up with the syndrome COVID-19 is very small, very small.
That's great. Elizabeth, going back to obviously trying to keep our videos as short and direct as possible, I have many questions on the back of that, as I'm sure many of our viewers will have as well. These videos are going to be an ongoing series. We will be revisiting many things in greater detail. A couple of questions I just want to ask you just quickly on the back of that. We know that the numbers and the figures that obviously are being talked about worldwide, which we're going to do a video on that as well. But in the short term, what's happened to the flu? Where did the flu go, Elizabeth?
Well, there's a lack of testing for this new novel coronavirus. And in absence of testing, anybody with flu-like symptoms, anyone with any sort of respiratory distress is being labeled as having the coronavirus. Everybody is being assumed that that's what's causing the illness. And it's really just, I don't want to say laziness, but it's labeling that is inappropriate. To suspect everyone has coronavirus is just the same as saying, well, I suspect everyone has the flu. It's a label that people are using, and they're just not labeling it as flu anymore, even though flu is circulating, even though people are probably infected with the flu virus and sick with it. They're not. Everybody's just presuming every respiratory illness is coronavirus.
You mentioned something there, which is one of my next questions to run by you, which is, can you actually test accurately for any virus? Now, I've obviously done my own studies as well as the conversations you and I have had over the past years. People obviously talking about signature systems within viruses, but when you reply on the question of can you accurately test for any virus, can you include that a little bit about exosomes? I didn't mean to discuss that with you earlier, so we're going to have a detailed conversation about exactly how viruses enter the cell, how they change that, how the body reacts to it. And it almost expels, doesn't it, an exosome from the cell, where the cell is obviously reacting to that particular virus.
Right. So exosomes are a way, in general, backing up and talking about the big picture, exosomes are a way for cells in our body to take out the trash, basically. So the cell creates a ball of trash it wants to get rid of and puts it in a garbage bag, which is a capsule of protein, and expels it. And exosomes and viruses look a lot alike. I actually personally believe that this situation is going to cause a big shift in how people think about viruses on a medical level. That research is probably down the road. But exosomes are something that the body does all the time to get rid of toxins and things that it doesn't need and debris. It's a garbage clearing system. And viruses look a lot like exosomes. There's some surprising characteristics that are similar.
So to wrap up for today then, and obviously we'll let people know what we're going to be talking about in the next episode, can you actually test accurately for a virus?
So there is currently not a 100% sensitive and 100% specific test for this virus. And that, can you test for any virus? There's no perfect test for any virus. And there's the tests that are coming out for this new novel coronavirus are coming out so fast and with so little testing and quality assurance that I am not sure that a negative test means negative or a positive test means positive for actual infection with the virus. But of course, just having viral particles, that's all the test is testing for are there viral particles detected, is not the same thing as infection, and it's not the same thing as becoming ill. So I think that the question of accuracy and ability to test is up in the air, even though we all are looking for that perfect test that's going to tell us what's going on. I don't think it exists.
Elizabeth, thanks for that. Let's go back again to keep these videos short and brief. Our next video together, we're going to be talking about what you can actually do to protect yourself. Let's look at vaccines. Let's look at wearing gloves, wearing masks. And thank you ever so much for that information. I'm sure it's going to generate a lot of questions from our viewers, and look forward to seeing you in the next video.
Yes.
Elizabeth, bye for now.
Bye for now.
Bye.